I will tell you this science has, or investigation has evolved quite a bit, and while it's not as rapidly changing as H1N1, I have modified the slides a little bit to address some of the issues that came out of the Tampa conference last week. I also have included in the handout a couple of cases about asthma. While asthma is one of the issues that are brought up as far as one of the complaints from the ATSDR, what we're dealing with here is really sulfur compounds, and by the nature of its solubility, it will usually affect the upper airways. Rob?
I know one of the questions, because homeowners have these symptoms, and they'll say, you know, a nosebleed, it's pretty objective. And we saw at the technical symposium that even the CPSC representative said from being in these homes, he had developed what he thought were some respiratory symptoms. Is the fact that we may have problems on Daubert or trying to prove this long term mean that there are no effects, or this isn't real, at least as an irritant?
Well, I think there's several questions in there. One, as a clinician first and an investigator in this, I will tell you that the top 10 causes of nosebleed happens to be trauma. Whether it's dry air and there's irritation and you're sneezing and you're blowing your nose, or other types of trauma. So there are many causes of that. As far as the irritation is related to mixtures and irritancy potential, however, what you'll find, and a lot of the research that we found, as well as what the CPSC has found, is that there are a mixture of chemicals, but by and large the highest ones and the most irritating ones are formaldehyde, which is really not related to Chinese drywall. It's related to various furnishings. I'm going to go through Environmental Health Investigations 101 and 201, because what happens is when you get a set of records and a set of health complaints, how do you get your arms around it? And I like to just show you this, and that will help you whether it's formaldehyde, mold, or sulfur compounds that we have here. And then I'm going to take the second half of the presentation and talk about irritant toxicology 301. So I'm going to try and squeeze a lot of information in here. So you get a call from a homeowner, very emotional call. They said, hey, this stuff is killing me. My wife has cancer. We're sick. And we're going to evacuate. So what can we bring, and what can we clean, and what should we remediate, and what can we keep, and is this permanent? Now what do you do? Okay, so this may be a set of records that you get or you hand over to somebody, and the way I would approach it is, while you have a high index of suspicion about the particular complaint or the cause or the trigger, you have to recognize that odor, because that is objective and noticeable, it is not unusual that that gets to be attributed to be the cause or the only cause. And when we look at these issues, we don't just look at one thing. We want to make sure there are no non-environmental causes. So, you know, when we have a set of symptoms, we do a good differential diagnosis to see what is the condition that may explain these set of symptoms. And then we look at what can cause this diagnosis or condition. And if it's environmentally related or indoor air related, and it's not an infectious process, we say, hey, could this be an allergy or an irritant? What's the mechanism? Because that tells you how to investigate it, that tells you how to resolve it, and that tells you how to make the evacuation or relocation type of recommendations on a health basis. And then there are special considerations that I'll talk about that you should really tease apart. And we're going to touch upon issues such as odor, irritation, dose, and health. Okay, so they're both sick. They advise you that the HVAC contractor said other neighbors are sick from this Chinese drywall. They've been in there for 3.5 years. They have 2 dogs. They use municipal water and municipal sewage, and there's corrosion at the coils. And they've been told by the HVAC contractor that this is the type of corrosion from Chinese drywall. The husband is an account executive. He travels a lot. He has choking sensation at nights and frequent asthma attacks since moving into the house. He travels for work and smokes an occasional cigar, and he's a social drinker. His wife was diagnosed with lung cancer 9 months after moving in. but it was treated successfully. Now she has a lot of headaches, basically. She has a past history of secondhand smoke, that's the ETS, environmental tobacco smoke, and a brief history of cigarette smoking. And of course the environmental inspector said, yeah, we found some trace formaldehyde too, and you need to get out, and we have a solution for you if you want to buy it. Basically that's ozone. O3 is ozone. So here's the ATSDR reported symptoms. And so what do we have here? We have difficulty breathing, cough, recurrent headaches, asthma attacks. So does this meet the case definition? So when we say, okay, take one of them, what can cause a cough? Just holler it out if you can. What can cause a cough?
Bronchitis.
Bronchitis. Anything else?
Cold.
Cold, all right. This is flu season, right? We have flu season. Hay fever, sinus conditions, asthma, any type of lung condition, any type of tumor or mass or reflux at the bottom or some rheumatologic conditions. So all these, they're not going to be, some of these may be associated with the indoor environment or Chinese drywall, but some of these are not, and you need to be able to tease them out. So, homeowner says no odor. They don't see the odor. They have the corrosion. So why is this clinically important? And that's very important to investigating odors and irritant toxicology. And that speaks to the issue of safety margin. And that is, with volatile chemicals, there are various levels of effects. The odor threshold is usually orders of magnitude lower than the toxicological threshold or irritant threshold. At about 4 to 5 times the odor threshold, you get something called annoyance. And that's a sensory concept, and that may even change your breathing pattern and maybe increase your heart rate some. At the irritation level, it's usually a nerve ending or trigeminal nerve mediated process. And and by and large, it's about 3 to 4 times the order of magnitude of the odor threshold. So what that speaks to is what we call the safety margin, where you notice the odor. Like Dr. Perrin said, we add mercaptans to natural gas. When you smell it, you know it's a problem, right? Way before it becomes an issue. Some of the triggers for asthma. This gentleman has asthma. What are the conditions or triggers for asthma? Now, you can have pages of this, but what we found, I just listed a few here. Viruses. It appears that the hospitalized patients who are hospitalized for asthma now, or as we are getting better with technology, we find that many of these are coming in as a result of viral infections. Or there may be a bacterial infection, allergic reaction. Reflux can cause it, or stress. So, gentleman now admits that he binges a little bit, eats spicy foods, and he also has this choking, coughing sensation on business trips, and says, I'm kind of concerned about my wife too and her condition. So at the end of the day, after much workup, this gentleman really had reflux. And what we found with reflux and asthma is individuals who have asthma and reflux, if you aggressively manage the reflux, 85% of the asthmatics will have their symptoms controlled.